Let's talk about the transgender
Good,
group
good, good,
because
good. Yeah,
that is huge out here anyway in San Francisco,
yeah,
of course.
yeah,
But in Connecticut, you have quite a little following there, don't you?
yeah. I really am glad you brought that up, Catherine. Thank you. Trans women who began their journey as men who have male pattern hair loss and are now living as their gender is they need to confirm their gender. I mean, outwardly. In other words, you can wear a wig and have a female hairline. Most patients don't like that. Um, so men with hair loss that become women with hair loss need to treat it. And those are some of my most gratifying patients for me to work with because it can be transformative for them, and they're also grateful patients, and they will tell their friends. And I do have people travel far and wide for that. So I've had trans women with male pattern hair loss that we correct and create a softer feminized hairline. I've had trans men who we want to do beard and facial hair transplant on. That testosterone doesn't bring it all back when you start your hormone replacement therapy. So being open-minded, being compassionate, um, I learn from my patients, and yeah, I will tell you, kind of stumbled along, and I still stumble along with pronouns, and sometimes a struggle, and I, but I'm also tuned into, these are individuals that are suffering, and you can help alleviate their pain, and they come back and crying tears of joy, and by the way, telling a half a dozen of their friends to travel to Connecticut. I mean, it means a lot. It really is a good thing to do.